Hi everyone, it's me, Melanie, your IVF nurse, and this video is just going to quickly review Saizen, which is a growth hormone that we're seeing incorporated into IVF protocols. Now, just to be completely upfront with you, I am familiar with using this medication. I've worked with many doctors that have either chosen to use it or chosen not to use it, and it usually goes with how much research they've been able to read or find about the benefits, risks to using this in an IVF cycle. So I have worked with some doctors that will not use it, or they don't recommend the use of it because they find that there is not enough evidence to support the use of it. And then I have worked with many doctors that will go ahead and prescribe it in an IVF cycle. So it's important to know that not all doctors will incorporate this, but hopefully you've got a physician you're working with that will listen to your questions or address any concerns you have if this is something that they are contemplating in terms of adding it to your protocol. Now, what is Saizen? Saizen is a growth hormone, and it's important for the growth of muscles and bones. And when we normally see it being used is to treat growth failure in children and adults. Now, we know that growth hormone can act on several organs, including the ovaries. This is where the eggs are. So this is where we're seeing that the rationale behind why a physician would be incorporating it into an IVF cycle or prior to an IVF cycle, depending on the protocol and your medical history. Now, when you're using it for fertility, it is thought to enhance egg quality. And that, I think, is where some of the information that people are seeking is kind of hit or miss. So, like I said, not all doctors will use it because sometimes there's not enough evidence that's found in some of these research studies that are going on to make them feel comfortable with incorporating it into their protocols. But it is most definitely something to discuss with your doctor to see what their thoughts are on it. Now, one of the things that is important, that if you're going to be using this as part of your fertility treatment, your clinic may ask for you to sign a waiver because in Canada it is used off-label. So it is not indicated for the use of fertility treatments right now, but hopefully the studies that are being done on it will one day have it pretty standard and routine for those that would benefit from using Saizen in their IVF protocols. Now, who does it benefit? What they're looking at is that it would benefit, obviously, the older population because as we age, we know that our ovarian reserve decreases. They're also looking to the fact that it may help those that are poor responders. And these can be people that are younger, but those are not responding for whatever reason. And then the other thing that it benefits is the regulation of hormones. So those are the three things that you're going to see if this is going to be indicated for you in your IVF protocol. Now, when you pick up the medication, you will have a start date and the clinic will determine that. That'll be in your protocol. Sometimes it's started before the IVF cycle. Sometimes it's started at the same time the IVF cycle starts, so with your FSH and LH combinations. One of the things to understand about the possible side effects is that because it's an injection, like all of the injections, it's very normal to have redness, itching, swelling at the injection site, or irritation at the injection site. Bruising is always normal with an injection. If you're finding that you don't normally bruise, then yay, you're very, very lucky, but bruising is a common side effect of injections. The other side effects that you may find is that you might have muscle or joint pain. The other thing as well is headaches and fluid retention or swelling. Now, headaches and fluid retention can also be if you're using it during your FSH and LH medications as well. Those can be contributing to it. So it's important to kind of say, okay, well, if you started your Saizen before your FSH and LH and you're kind of feeling headachy, then yes, you can say it's the Saizen. But a lot of the times when people are using FSH and LH, it can cause them to feel a little bit foggy, have a bit of a headache. So for headaches, Tylenol is fine to use, provided you're not allergic to acetaminophen. If you're finding that Tylenol does not help, then you want to be reaching out to your clinic to let them know. In terms of fluid retention, that's another thing where people are always so concerned with gaining weight while they're doing hormones. So that is quite temporary. So once your IVF cycle is completed, you should find that all of your side effects should resolve, hopefully. Now, one of the things that's important to note about storage of the medication, when you pick it up, it's going to be a liquid and powder. So it's going to be 2 vials. One is going to be the liquid, like I just said, which is a sterile water or sterile diluent is how we refer to it. And the other one is your powder medication, and that is the medication. As long as it's not mixed, it can be stored at room temperature. Once you get the date to start the injections, you're going to follow your clinic instructions. However, once you've reconstituted or mixed your medication, you want to make sure that you're storing it correctly. So once it's reconstituted, into the fridge it goes, and you want to make sure it stays in the fridge until you're ready to do your shot, and then from there you would put it back in the fridge when you're done. But your clinic will go through all of that with you as part of their injection teaching. I hope you found this helpful. Please feel free to email me at yourivfnurse@gmail.com for general information about my services. If you've got anything specific that you'd like to ask me or reach out to me about, you can reach me at melanie@yourivfnurse.com. You can check out my website, www.yourivfnurse.com. You can follow me on Instagram at yourivfnurse. You can also subscribe or comment down below to my YouTube channel. Thanks for watching.